We're here with Christina, who now has a bit of arthritis through her knee joint. And for this exercise, I've chosen footwork on the reformer because one of the things that we can work on is unloading her knee, but still training her quads and her hamstrings. So we're going to start on her heels, about hip distance apart. What I'm going to be watching for and cueing for is the tracking of her knee and the quality that she feels in the movement. I'll just have you press back. I've got her on 2 reds and a blue. And I'm like looking at her knee alignment, and I'm aiming to have her track her kneecap, her patella, between her first and second toe. And I could do a lot of these repetitions, even up to 20 or 30 repetitions, provided that the quality was engagement of the quad and not pain underneath the kneecap or along the medial or lateral part of the knee. Feeling a stretch through the back of the knee is also very good quality. So engagement of the quad, lengthening in the back, that's what we're looking for without the provocation of joint pain. Please let me know if you guys have any questions about how to work with someone that has knee arthritis doing footwork on them.